Thank you for joining us for today's Wellness Wednesday program. I'm Kathy Poole.
And I'm Kaylin Harris.
Our goal of Wellness Wednesdays is to share information vital to your health and wellness. In support of Save Your Vision Month, today's guest is NGH optometrist, Dr. Feyi.
Dr. Feyi is board certified in optometry and specializes in refractive disorders, diabetic eye disease, glaucoma, and cataracts. Please feel free to ask any questions in the comment section below. And without further ado, here's Dr. Feyi.
Hi, everyone, and thank you, Kaylin, for the introduction. I'm Dr. Feyi Awarenche, and I'm so excited to come to you today to talk about the importance of eye care and vision health. It is Save Your Vision Month, so we are wanting to promote the importance of eye exams because, believe it or not, regardless of whether you have good vision or not, eye health is very important in how we navigate our lives and experience the world around us. There are many diseases that can affect the eyes that you wouldn't know were occurring, and it would be my responsibility to find them for you. We can find a number of diseases that affect the body that they affect the eyes as well, such as diabetes, high blood pressure, and even certain cancers can be found by having an eye exam. So I have a short video that I would like for us to watch to give you a glimpse into what I see when I'm doing my exams.
The Comprehensive Dilated Eye Exam, opening the door to preventing blindness. During a comprehensive dilated eye exam, the patient receives special eye drops that dilate the pupils. The pupils open wide, allowing the doctor to see the back of the eye clearly. With a better view of the back of the eye, the doctor can look for signs of the common eye diseases that can lead to blindness: glaucoma, diabetic retinopathy, and age-related macular degeneration. When eyes are dilated, the doctor can clearly see the retina, optic nerve, and the macula. This is the optic nerve. The doctor is looking for early signs of glaucoma. This patient's optic nerve is healthy, but here's what it would look like if it showed signs of glaucoma. The doctor will see changes in the shape or color of the optic nerve. The doctor may also see what is called cupping of the optic disc. Glaucoma is most common in African Americans over the age of 40, people over 60, and in people with a family history of glaucoma. In addition to the optic nerve, the doctor can also clearly see the retina at the back of the eye. The doctor might see signs of diabetic retinopathy. Early diabetic retinopathy starts with small red dots called microaneurysms and can progress to leaking blood vessels, causing thickening of the retina and blurring of vision, or new blood vessel growth that can bleed and cause blindness. If you have diabetes, you are at risk for diabetic retinopathy. While still examining the retina, the doctor can also look for signs of age-related macular degeneration, or AMD. If this patient had AMD, the doctor would see yellow spots beneath the retina, called drusen, or dark clumps of pigment. AMD is the main cause of visual impairment and blindness in older Americans. Dilation enables doctors to get a better view of the back of the eye, which allows them to determine whether there are early symptoms of disease. But it's important to know that all people older than 60 need a comprehensive dilated eye exam each year and should inform their doctor right away if they begin to have problems with their sight. People at higher risk may need to have a dilated eye exam more often. Risk factors, including race, age, and family history, are all important to determine how often patients should receive a comprehensive dilated eye exam. To learn more about comprehensive dilated eye exams, common vision problems, and eye disease, visit www.nei.gov. www.nih.gov/healthy eyes.
So I'm not sure if the video was able to play all the way through the video for you, but hopefully you were able to hear some of the audio that explained what your doctor would be looking for during a dilated eye exam. And hopefully we can include a link to that video in the comments so that way you can view it on your own, because it does give you a glimpse into what I'm able to see during an exam. And the eye is such a beautiful thing. It's the one part of the body where I can look into and see what's going on with the rest of your body. So hopefully you'll get to see that video for yourself. So I'd like to open the floor for any questions you may have for me to answer, and we'll go for it.
Thank you, Dr. Feyi. We did have a question sent in earlier from one of our followers. Her question stated, "My husband is diabetic. His vision exam indicates his glasses have his vision corrected, but he has trouble driving and seeing like he should. Could this be caused by his glucose ups and downs?"
Thanks. So when we're talking about vision changes due to diabetes or other reasons, it's important that, one, we have a proper evaluation to actually know what's going on. If we're considering the effects of diabetes on the eyes, there can be vision shifts in your vision or vision changes that are related to blood sugar changes. I have patients tell me when their blood sugar is high, they can't see anything. And when their blood sugar is normalized or at a normal level, they have no problems at all. They don't need their glasses. So a lot of times we have to determine if a prescription is needed at that time, because your doctor may say, now's not the time to get glasses. Let's get your blood sugar under control first. So it's definitely something that I would recommend having an evaluation for, just to see if it is related to blood sugar changes. Other common causes of fluctuation in vision could be due to dry eye or even focusing issues with the glasses prescription.
Thank you.
Thank you, Dr. Feyi. We have some questions that have been asked as well on our Facebook channel. So the first question is, how many times a year should you get an eye exam checkup?
Awesome. So what's recommended for adults would be once a year. Some people are a little flexible and would go to twice a year, but a lot of it really depends on whether you have any medical conditions to monitor. Diabetes and high blood pressure being two of the most common ones that we recommend annual exams for. But other conditions like glaucoma and macular degeneration would warrant more frequent exams. So we're talking potentially 2 to 3, sometimes even 4 times a year, depending on what you have going on. For children, it's recommended that they have their first eye exam before they start school. So a lot of times that would come in the form of a vision screening. But I personally recommend that children have a comprehensive evaluation just to go beyond just vision, but also make sure that their eyes are healthy, because that will set them up for success in the long run.
Thank you. And then another question that one of our followers sent in is, what is good for itchy eyes or watery eyes?
Okay, that's a common question. I get that one multiple times a day. So when we're talking about itchy, watery eyes, it's typically or more commonly one of two things, either due to allergies, whether it be to something in the environment or something that may have gotten in the eyes, and also dry eyes. So when we talk about watery eyes and dryness, the two don't often go together, in your mind. But what happens is that itching and watering feeling is that your body is signaling something is irritating or affecting the eye. So there are a number of things that you can do to take care of that issue, but I would recommend having it checked first to determine what is causing the itchy, watery eyes. It could be allergy or dryness, and oftentimes it's both.
And then I definitely want to ask this question. So as we are moving into springtime and summer and things are of course getting sunny outside, what is the best type of sunglasses, or what are the best type of sunglasses to protect your eyes? And then should we worry about eye protection when it's cloudy?
Awesome question. So sunwear, protective sunwear is very important when we're talking about preventing eye disease or decreasing your risk for certain eye diseases and even eyelid cancers. So it is important to wear sunglasses, number one. The best type of sunglasses would be ones that are UVA and UVB protective. So the ones that the cheapy glasses or the throwaway glasses that you're able to find at the store, believe it or not, some of them are just pretty much tinted plastic without any UV filtration in them. So if you are purchasing sunwear, you do want to make sure that they are labeled according to that standard, that they will filter UV light. To your second part of your question, it is important that you wear them year round. So UV rays we're exposed to them regardless of the sun being out or not. So it's one of those things, just like sunscreen. You hear it recommended that we should not only wear sunscreen when it's sunny outside, but even on cloudy or overcast days, because we still risk that exposure. Beyond sunglasses, of course, wearing hats are helpful, but you definitely want to get a pair that covers the majority of your eyes. So I know many of you may have seen the fashionable lenses that are very thin and sit below, low on the nose, but those are not adequate to protect the eyes. They're fashionable, but not the best for eye protection.
Well, thank you. Thank you very much for your answers.
With the pandemic, many meetings have gone online, whether you're working from home or coming into the office like we are here at Nashville General. Is there such a thing as digital eye strain? And then we're hearing a lot on the blue light filtering lenses. So are those worth purchasing?
So yeah, let's talk first about digital eye strain. So digital eye strain is, or even there's a term called computer vision syndrome, which is just coming from individuals who are spending a prolonged amount of time in front of screens or any digital device, so tablets, even our phones. So it's thought that with the prolonged time we're spending in front of screens, we are using our eyes in a different way than they may be accustomed to. One, because of the distance we're often working with. Our computers are usually within arm's length or maybe a little bit closer in or beyond, but anything within that range, our eyes are focusing at a different level than if we were looking far away when we were driving or watching TV. So just by sheer nature of how close we're working to these screens, it puts us at a risk for eye strain. Number two, the light coming off of these screens, it's blue light. Essentially, if we're breaking down what blue light is, it's everywhere. The sun gives off blue light. Blue light is the majority of our visible light. However, when we're talking about natural blue light versus man-made or manufactured blue light that we have on the screens, it's hard to say how much of an effect that they do have on our eyes. Some research, although limited, it has shown a little bit of a negative effect on the eyes as far as putting us at a greater risk for certain eye diseases. However, it's still limited because devices have not been around long enough for us to know the long-term effects. So I always tell my patients, you can get them, but they may or may not work. I will have patients tell me that they do feel that their eyes are a little more comfortable when they do wear them, just because of the filtration that they're getting, whether it be from the screen or their phone. It's also been shown, or blue light has been also shown to have an effect on our sleep cycle. So I know those of us with smartphones, we might have little settings that we can adjust the kind of warmth to our screen where things are a little more yellow versus the harsh white. So some blue light filtration glasses work in that manner. So it is a thing, but it's in development. We still don't know enough to really firmly say how much of an effect blue light has on the eyes, but a lot of people who wear the glasses, they find it beneficial. So it might be worth a try.
Great.
Okay, perfect. Well, that is all the time that we have today. Thank you everyone who has joined us this afternoon for our second Wellness Wednesday Facebook Live event. If you would like to schedule an eye appointment with Dr. Feyi, please call 615-341-4968. Once again, that number is 615-341-4968.
And mark your calendars for next week's Wellness Wednesday event. We will have Betsy Vaughn, a nurse practitioner in our Digestive Health Center, providing information on colorectal cancer awareness month. Colon cancer is the fourth leading cause of death in the cancer deaths in the United States. And with early detection, it is estimated that well over half of the deaths that occur annually could be prevented. So please join us for this very important session, Wednesday, March 24th at 12:15.
Have a lovely day, everyone.
Thanks, everyone. Bye.